Morning.
Sorry, good morning.
Okay, guys. Good morning and welcome.
Morning.
Good morning. How is everything? Good. Okay, guys. So we're going to start. Now, before I continue, any questions, guys? Yep. Then we can just go layering or layering. Go. O being yes, okay now. Combining vowel. Now, guys, please keep in mind that okay, yes, or here became layering actually is larynx. Okay, so the actual word is larynx, but mainly that's okay since we are going to use it here to make new terms by putting suffixes and prefixes to it. We can mean it's okay, just go with larynx, but the actual word is larynx. Which mainly is okay, just mean what we call the voice box. And we're going to talk more about this fellow here. It's okay when we get to anatomy physiology and talk of the respiratory system. Okay, so right now we're just going to just okay make some words. Laryngeal. Okay, just pertaining to yes, okay, whatever become the larynx. Clear? Okay. We can say larynx. O. Okay. Scope. Clear? Okay. And whenever we say scope, we can also say laryngoscopy. Okay. We can also say larynx. O. Tomy. Okay, which means okay, means yes, okay. Cutting into the larynx. Most likely, it's okay. The common term that the common clause will be laryngeal. Something yes, okay, wouldn't be. Falling. Okay. Did you guys get that? Now, guys, you can say it's okay. Next word is okay is letter. And which we mean is okay, just mention, we mentioned yesterday, means side. So that's when we said lateral. Okay, which okay, as you get pertaining to. For me, it's okay, pertaining to the side. So this becomes a directional term. And what I said is, if this here is medial, then as you move to the side, you're moving lateral. Did you guys get that? Okay. So you can say it's okay that your arms are lateral to your chest or trunk or whatever. Clear? Okay, because they are on the side of your chest. Did that make sense? Whereas, okay, when you go in the opposite direction, you then say that the chest is medial to the arms. So lateral and medial are opposite terms. Clear? Okay. Is everybody clear about that? Okay. You may at some time, that's okay, hear the word, you can say bilateral. Okay, which means okay, the comment is okay, pertaining to, yes, okay. You can say it's okay, side or sides. And here's okay by, all is okay by me. Two, but we can also just okay use it as both. So bilateral on both sides. Okay. Sometimes it's okay, they may, it's okay, use the word collateral. Which again is okay, or mean is okay on both sides. Okay. Did you guys get that? But generally speaking, is okay, the term that we will talk a lot about or use most is going to be lateral, which is mainly is okay, just a positional term, which mainly means we can just okay on the side of. Yep. And okay, yes, it's going to be opposite to medial, which mainly is okay, just means pertaining to the middle. Now a word. That's fine. We can say lump. Oh, now lump is okay, mainly is okay, as we said yesterday, was the waist Oh, yes, okay, what we also could call, yes, okay, the line. Now, one thing that we mentioned yesterday, for instance, okay, was lump. Ah, okay. Where this just becomes just okay pertaining to the lump, the waist, or loin. Okay. Now, usually it's okay. You can say it's okay. The lumbar, for instance, vertebrae. Okay, so then that becomes okay. The vertebrae of the loin or waist. Or you can say lumbar region, which you mainly would say is okay. Will be the region of the waist or loin. Now, guys, another thing, and that's what they call is okay a lumbar puncture. Okay. Now, this may also be known as a spinal tap. Okay. Now, guys, please do not confuse this with a epidural. Okay, because okay, what they do in an epidural is that's when they is okay. Meaning is okay, will inject medication. And the reason that we call it epidural is okay into the epidural space. Now, when we say lumbar puncture, you can mean is okay, it becomes pretty clear from the word tap. Okay. Now here it's okay. Usually it's okay when you do a lumbar tap, it's okay, or a lumbar puncture. It's called lumbar mainly because okay, it's done in the lumbar region. Pretty much okay in between L3 and L4. That's where the mainly is okay. We'll go with a needle in between these two vertebrae through the dura mater, through the arachnoidelia, and actually it's okay, want to tap or get a specimen of the cerebrospinal fluid. Okay, so usually it's okay when we poke to obtain a specimen of something, you will see the word puncture. Did you guys get that? So, for instance, okay, when you go and for instance, okay, when you go to the phlebotomist for him or her to just okay, do phlebotomy. Now, what is that they do? They get a specimen of blood from your veins. So what they actually is okay, they may say, well, we're going to perform phlebotomy, but it's okay for that. And when they get a specimen of blood from your vein, well, okay, that can also be called a renal puncture. Okay, so whenever it's okay, we use the word puncture, that's mainly it's okay to obtain a specimen. So that's why they call it lumbar puncture, because lumbar mainly because it's okay, we obtain it from the lumbar area, pretty much okay, in between the lumbar vertebrae. Did you guys get that? So it's okay. It is quite a big needle, pretty much something like this big, but it's not all of the needle that goes in. Okay. Some of the needle have to stay out, or it's okay for the fluid to be tapped. But yeah. Hopefully it's okay. The patient won't be able to see it because he or she is lying in, or you can call a fetal position. So they mainly place the patient in a fetal position. Okay. So, any questions, guys? Now, next word will be lymph. Now, literally, guys, okay, well, lymph by itself is going to be as okay, it's a fluid. Okay. It's a fluid, and we mainly as okay, not really, but as okay. It mainly as okay plays a role in okay as what we will call the lymphatic system. Or mainly as okay when we talk of the lymphatic system, that's when we may as okay just come across as okay the term lymph, where you mainly can say okay the lymphatic, the word lymphatic, lymph is lymph. Here we can say it's okay. Yes, okay, maybe it's okay. We're combining vowel that they use and tick pertaining to. Okay. Sometimes that's okay. They may call lymph as a fluid, or they may even refer to as lymphatic fluid. Right.
So this is one of those cases where there's going to be no O, but it's still a combining
Yeah,
vowel, the A.
yeah, yeah. Okay. And just try to say the word lymphotic. It doesn't sound chick, if you want to put it that way. So lymphatic is more like okay, sounds more okay. Yeah, it sounds good to the ears. Let's put that compared to yes, okay, lymphatic. Okay, but then you can say as okay. You may have O, for instance, an example. Oopsie, sorry. Lymph. Okay, here we have O, but then we go as okay, sites. Okay, where site, that's okay, would mean cells. And okay, as they're going to be as okay, a type of cells which we call lymphocytes. Okay. These will be discussed, especially as okay when we talk white blood cells. And okay, as the circulatory system when we talk blood, or when we talk about blood. You will also say it's okay that in the lymphatic system there's going to be, it's okay, what we will call lymphatic glands, or you can even say it's okay, lymphatic organs. Right, okay. Now, guys, next word. Media Stein. Oh, now here is okay. The word media itself means that, okay, yes, it's something which is in the middle. Okay. Yesterday, it's okay, when we answer our questions, we say it's okay. Mediastinal. It is pertaining to the mediastinum. Where, okay, yes, mediastinum could be, it's okay, the mediastinum. So what we could call is, okay, the mediastinal space. Can also is, okay, called the mediastinum. So when you ended up with that means in the case that, okay, yes, this is the name of, yes, okay, this structure here or whatever. In this case, is okay, mean the space. And what was the mediastinum or the mediastinal space? That was, okay, as the space between the two lungs. Okay. So you had two lungs. That's okay. We had a right lung. We had a left lung. And there's that space between these two lungs was what we'll call the mediastinum or mediastinal space. Did that make sense? We can go on to our next term, which is pelv. This is mean that's okay, derived from the word pelvis, which actually is okay. We can say it's okay, is the joint or is the name for your hip. Now, usually, guys, is okay when we say pelvis, such. Now, mean it's okay, your hip bones. Okay. If you don't want to use the word pelvis, but still want you, it's okay, chalk off, it's okay, the hip bones, you can always go and say it's okay. There's nothing wrong in saying it's okay, the pelvic bones. But here's okay, it just becomes it's okay that pertaining to the pelvis bones. Right, okay. We also, it's okay, use the word pelvic. When, for instance, okay, talking about the subcavity of the abdominal pelvic cavity. Yes, okay, the pelvic cavity. But we could put, yes, okay, or other root word in front of it, which we're going to be abdominal. Okay, then okay, it's abdomen was the word. O in this case, yes, was mean, it's okay, just the combining vowel between abdomen and pelvic. Okay. You find this okay, can have, let's say it's okay. You have a pelvic bone fracture. Now it's okay, it is going to be a pelvic bone fracture, or it can be also be stated as a fracture of the. Now usually it's okay, then whenever go as okay, fracture of the pelvis. Did you guys get that? So here's okay, the pelvis for me, it's okay, just bring these two into one. Of course, there's nothing wrong of saying it's okay, fracture of the pelvic bone. Okay, nothing wrong in that. But you end up, yes, okay, just have to go like a fracture off. You still go pelvic, and then you still have to write bone. Clear. Okay, so when you talk of okay documentation, when you talk of documentation, then okay, as you want to keep it as short and evenly precise as possible. Okay, good. Baritone. Now, what about the baritone or baritone? Okay, and we can see if we need it, it's okay. That may be a combining vowel, but this one means it's okay. To be more precise, we can go and say baritonium. Okay, okay, what the yum. Now the just means that okay, this whole word here just becomes the name. And what was the peritoneum? A membrane that covered most of the abdominal organs.
So is that's a two-layer membrane?
Yes, my dear.
Okay, thanks.
And I think I gave you the cheat for the copy and paste because I started with a P. Just like the pleura, just like the pericardium. They all start with a P. So what is that these three here have in common is they are all two-layered. Clear? Okay. Okay. And here is okay, the names of the layers are going to be the same. Outer and inner. The outer layer of all these three membranes here is going to be called the parietal. And the inner is always going to be called the visceral. And in all these three membranes, that's okay, there's going to be a fluid in between these two layers. And what do we call it? The name of the membrane? Fluid. So if you said plural fluid or plural membrane, the fluid will call the plural fluid. You said peritoneal membrane, the peritoneal fluid. You said pericardium, pericardial fluid.
I thought the pleura had 3 layers.
No,
The arachnoid.
no, that's
Arachnoid,
where you,
no?
no, that's your meninges, my dear.
Oh, okay.
Your meninges had 3 layers. Your pleura has 2 layers, my dear. Okay. That was your meninges, and okay, the meninges doesn't start with a P. That's when you go to meninges, that's when you have, okay, yes, you had an outer, then we have a middle, and then we have, okay, yes, an inner. The outer was dura, the middle was the spider web, and the inner was, okay, yes, pia.
Okay, thanks.
Okay, and here, guys, the fluid is okay. So the fluid here is going to is okay what we call CSF. That's mainly as okay what we obtain in is okay what we said earlier was the lumbar tap or spinal tap or lumbar puncture. What they actually is okay tap is going to be as okay a specimen of CSF, cerebrospinal fluid. Okay, so here's okay that needle. It has to pass through the dura. It has to pass through the arachnoidal space or arachnoida to get to the space underneath the arachnoidal layer, which is going to be as okay subarachnoidal. Okay, it's only when the tip of the needle is in the subarachnoidal space that it will be yes okay directly in yes okay where you have the CSF and verbatim is okay come out. Yeah, okay, so your pleura only got 2 layers, same as your pericardium, same as your peritoneum. Okay, that's where you can copy and paste. And the meninges, unfortunately, is okay. There's no copy and paste. There you have to remember, okay, tough mom. Okay, yes, then the spiders, and okay, yes, then the loving mom. Let's see. Any questions, guys? Okay, so okay, now in the peritoneum, we have what we call, okay, let's just use peritoneal fluid. Okay, now when we say that's okay, where here is okay, the EAL just becomes okay, pertaining to what? Peritoneum. Okay. We also said that, like we said, peritoneal, well, that's okay, that's okay, going to be pertaining to. What we said? Retro. But the word retro here is okay, mainly means it can mean it's okay backwards or behind. Okay, here we mean it's okay, we'll refer it's okay as to be behind. So anything which was behind the peritoneum. Okay, what's what we call retroperitoneal. Your kidneys, your adrenal glands, the major blood vessels in your abdomen were retroperitoneal. Okay. All those, okay, the branches that it gives off as it runs, those branches of your blood vessels are going to run in between the layers of the peritoneum. So the branches given off your major blood vessels, of which empties into the major blood vessels in the abdomen, those blood vessels are going to run in the peritoneum. But the major blood vessels themselves, aorta and inferior vena cava, are going to be retroperitoneal. Okay. Okay, guys. And now most of you as okay may come across this. And okay, now it's not really going to be as okay the actual peritoneal fluid. Or what we may say is that's okay, good is good, too much good is bad. So we can actually say that okay, yes, an excess of fluid in the peritoneal space. That is going to be as okay what we'll call ascites. Okay. So as okay, pretty as okay, very characteristic. It's something okay. As now, first of all, it's most commonly seen in men, and many men may be proud of it and say, "Okay, it's just a beer belly." Clear? Okay. But he most likely as okay may look like as he's pregnant. Now that's not something that a man would be proud of. Okay, that's the only thing that we don't want to get is pregnant. Okay, but it's okay. How you? It's okay. So okay, he just got a lot of gut, and okay, that this here actually is a beer bucket, or it's okay, beer belly, or it's okay that he actually has ascites. Now you mean it says okay, that's swelling or distension of his belly actually is okay will shift as he lie down. So it's okay, this distension actually will shift. They can also, do some small clinical steps, mainly to either create waves in the fluid, as what we used to call that fluid thrill. But one thing that will be very characteristic is that the belly button. Now, usually people's belly button are in. It pretty much disappears. It becomes pretty much flattened out. So you may not actually be able to see the belly button. And primarily due to the major reason for ascites is liver disease. And that's why you also see that Medusa's head, or what we call spiral nevi yesterday. Okay. Pretty much around there, around the area of the where the belly button would have been. So that's going to be these distended veins. And sorry, veins are not going to be blue, red, but rather bluish brownish in color. But you will not see a well-defined belly button. Okay. So pretty much as accumulation of excess fluid in the peritoneal space is what you would call ascites. Now that's where you guys may be coming into the picture, because what they may want to do is drain that fluid. Okay. Why? Because it's pushing pressure up against your diaphragm, so on. So the patient has a hard time breathing. So that's breathing is probably more important than being proud of having a beer belly. Okay, so what they may need to do is tap some of that fluid. Did that make sense? What do you have in all that areas? You have structures like the gut and so on, so the intestine and okay. And you don't want to puncture a hole in that intestine. Okay. So that's where it's in many instances, they may ask some of you guys to come scan the patient, so they make sure that that the needle just gets into the fluid space, and as they tap most of it out. Okay, so this is something that's a lot of people with chronic liver diseases like bad cirrhosis, chronic hepatitis, even as liver cancer and so on, so may as come for, just as make the death less or a little more comfortable. Well, that's going to come when it's time. But just make sure that the last what's our time is left, they have well, the best quality of life that we can provide them with. Okay. So ascites mainly that's going to be that excess amount of fluid accumulated in the peritoneal space. Did you guys get that? Okay. Now, why is it that you didn't want to just poke the intestine? Because once that needle is out, once that needle is out, well, yes, you brought a needle, but it's you poke the hole in the intestine. They take the needle out. But what do you have now? You have a hole in the intestine, right? And what's going to be in this intestine? Yes, guys, what will you have in your intestines?
Is it poop?
Poop or the future poop, right? Clear? Okay. Did that make sense? So what's that going to do now?
Gonna splurge everywhere.
Well, okay, it's probably just okay going to leak out of this hole, right? Pretty much okay, it's into the peritoneal space. Clear? Okay. And if that's the case, that's okay. That's where people can develop, that's okay. What we call is okay, peritonitis. Now you actually have okay, that's inflammation, or more or less correctly says okay, infection of the peritoneum. And now not only because it's okay, somebody is okay during a test or biopsy is okay, poked a hole in the intestine. The intestine may rupture by itself. Okay. People who haven't pooped for a long period of time, at some point it's okay, the pressure just gets so much that the gut may pop. Or things like okay, gunshot wounds, stab wounds, and so on. So right, okay. Stab somebody, and okay, yes, there's going to be a hole or so and so in the gut, and okay, contents from it is going to be okay, leak into the peritoneum, and that's life threatening. You can easily die from that. Okay, so yeah. Any questions? Anybody want to say anything? Ladies and gentlemen, staying quiet is not going to help you. Okay. Somebody just got corrected today because she taught something, right? Right, Victoria, had you not said that earlier, you would have been going on with the misconception of the flora having 3 layers, right? So
yeah,
please.
I'm
Yeah.
tired. It's been a long week.
The party is yet to begin, dear. Okay. Okay, guys. Good. We can just go on to the next, which is pleur. Pleur. Okay. And we could, for instance, say, now if you have a combined vowel, it's going to be an O. But that's only if there's a combining vowel. If not, we can say plural. Okay. Which is just going to be as okay pertaining to the plural. Okay, and all of the plural, that's okay. Let's just put it this way. A two-layered membrane covering the lungs. Okay. Now, guys, this can get inflamed. or infected. But that'll be as okay, what you call pleuritis. Okay. When we talk plural, okay, we said plural fluid. Okay. Now the reason that I bring this up here is mainly because we can see that if there is an increase in, or as okay, seeing an excess of this way, the pleural fluid, that is going to be referred to as a pleural effusion. Where you can see is okay when we use the word fusion. It has something to do with fluid, just as we are in the previous chapter said, transfusion, for instance, or even yes, okay, infusion. Yeah, okay, but that's excess of fluid in the pleural space or in the pleural membrane or in between the pleural membranes, parietal pleural and visceral pleural, is going to be referred to as a pleural effusion. Did you guys get that?
Is it effusion like with EF and then fusion?
Yeah.
Okay, thanks.
Okay. Okay, it won't be infusion because okay, why in the would you like to enter fluid into the pleural space? So here it's going to be effusion, but my point mainly was that okay, when you say fusion is not a genre of music that we are talking about, but mainly it's okay, talking about something related to a fluid. Just like a transfusion, an infusion. Okay, now when you go to the hospital or if somebody's in the hospital getting drugs infused or IV drugs or medications, that's going to be an IV infusion. Okay, but why do we call it an infusion? Because it's liquid. Okay. But that's a liquid put into the patient. That's when you call it an infusion. Here it's effusion, so it's mainly okay, you can say like as a accumulation of fluid will become a effusion. Did you get that there? Okay. And if you have, yes, okay, an extra accumulation of fluid in the pleural space, that's mainly just going to prevent the patient from being able to take a deep breath because the lungs will not expand enough because they're being pressed on the other side by the fluid and pleural space. Okay. So that kind of, yes, okay, that's when they may, yes, okay, ask you guys to come in and scan so that they I show that, okay, the tip of the needle ends up in the space where the fluid is, and they don't go too far, okay, puncture a hole in the lung. Did that make sense? Okay. Okay, when we say it's okay, pleural effusion, that's going to be an effusion, or it's okay, means okay, excessive amount of fluid in the pleural membrane. Clear? Okay. We may, as okay, just talked a bit about the similar in the peritoneum, but where it may, as okay, just has the specific name, ascites. Okay. So just like, okay, you can have a pleural effusion, you can also have, okay, an excessive amount of fluid in the pericardial space, and that's just going to be a pericardial effusion. Did you guys get that? Now, guys, one last thing. And that would just be, please do not confuse plural with plural. This here will mean pertaining to the plural. What does this mean?
Multiple.
Huh?
Multiple.
More than one.
More than
More than
one.
one.
Exactly. So boy, boys, girls, girls, men, or man, men. Okay, ice cream, ice creams. Banana, bananas. Clear? Okay. So that will be plural. Good, good, good. This will be the accurate. Good. We can just take the last one before guys go on a back. And that's going to be pharynx. And of course, it's okay. If we need to, it's okay. We may have a combined vowel O. Now, guys, just as we said earlier, here is okay, right? Pharynx, but the actual word was larynx. Just as we said in larynx, right? Okay. We said larynx or laryngo, where okay, the actual word was larynx. This fellow here is okay, is what we will call is okay, the voice box. This fellow here is just for your throat. So what people may refer to as a sore throat is going to be as okay, what we in technical terms will call pharynx itis or pharyngitis. Okay, where it means okay, just become pharynx, and then you go itis, pharyngitis. We can go on and say pharynx, or actually it's going to be pronounced as pharyngeal. Okay. You can say it's okay. Referring O scope. Okay. Now we may have is okay different parts of the pharynx. So we can say that's okay. There's going to be something that we'll call the naso. And here it's okay. It's not going to be pharynx, but it's going to be pharynx. So nasopharynx. Part of the pharynx behind the nose. We can even see it's okay. Another part of the pharynx is going to be the oral pharynx. Whereas, okay, oral comes from mouth. So pretty much occurs what the doctor may look at when he goes and say, open your mouth, stick your tongue out and say, ah, that tag of your throat that falls right behind the mouth of the oral cavity is what you call the oropharynx. Yeah. Right. So even sometimes, okay, that being inflamed or so on, so on, so will lead to a sore throat. Yeah. Now we say pharynx or pharyngeal, for instance. Okay. And then we have, okay, there's even a part of the pharynx which is going to be called the, we may call it the hypopharynx. And here you see it's okay, we don't use the word pharynx, use the actual word pharynx. Okay, so we mainly okay, we just use pharynx for pharynx. If we would add a suffix, that's where the X becomes G. Because, okay, from nasopharynx, you can actually, it's okay, you can say nasopharyngeal. Oropharynx, you can say it's okay, oropharyngeal. Or hypopharynx, you can say it's okay, hypopharyngeal. Did you guys get that? So yes, okay, what we in plain English is okay, called the throat is called the pharynx or pharynx. Any questions?
So would the definition of hypopharyngeal mean like the lower below the throat?
EL just becomes pertaining to. Pertaining to what? Hypopharynx. Now we may call it hypopharynx, we may call it the laryngopharynx. Okay. But those details, my dear, are going to be as okay relevant when we get to anatomy physiology. Good. Any questions? Nope. Nothing.
Should we know the abbreviations for like the spine, like C1 to C7 and so on for this quiz?
No, not necessarily, but it's
Okay.
all okay. Just remember it's okay. C for cervical,
Mhm.
T for thoracic, L for lumbar, and S for sacral.
Okay. Thank you.
Yeah, okay. Now there's no abbreviations for the coccygeal. First of all, it's okay, they are pretty small. Clear? Okay. Okay. And pretty much okay, as the reason that they may not have labeled or giving us okay a name or as okay an abbreviation to it is that okay there's no nerves exiting between the space of those vertebrae either. Clear? Okay. Because okay, a lot of the reason that okay as they named the vertebrae is mainly because okay the space between vertebrae they're going to be coming out nerves, which means that okay was be named as okay numbered. It may sound crazy, but actually it's okay be numbered in accordance to as okay the space between the two vertebrae from which it either exits the spinal cord or at the other end enter the spinal cord. Well, luckily for you guys don't have to deal with okay things such as the brachial plexus, the femoral plexus, and things like that. So, which is mean it's okay, greater networks of nerves where they say, okay, what's the rule value of this nerve? Yeah, so that's beyond your scope. That was for us to deal with. So one of the nightmares questions on our first second quiz pretty much was okay if they gave us okay as a question about the brachial plexus. So that nerve's coming from us okay C3, C4, C5, C6, C7, and T1. So that will be as okay the nerves that will make up the brachial plexus. But then yes, okay, which nerve of those is okay meet one another and then they split further and it becomes this okay, this nerve, that nerve, so and so. So that was it. Right. So not only because of the name of the vertebrae, that's okay, the numbering of the vertebrae, but also okay, is going to be okay relevant to the nerves. But you guys will still need to know okay, yes, when I say C4, what do I mean? If I say T5, what do I mean? That makes sense? Okay. Because later on, guys, okay, we are going to be using some of these vertebral levels as what I would call important anatomical landmarks. Okay, now what would be anatomical landmarks? Points that will mark or as okay indicate where something happens or as okay a structure undergoes whatsoever. So So you hear a lot of those anatomical landmarks when we get to towards the end of anatomy physiology. Because yes, okay, this thing here happens at this vertebral level. So if you don't know what the L5 means, then okay, as you are LOST. Did I make myself clear? Good, but that's all. Anything else? Nothing. Okay. Take a short break, refresh yourselves, and I see you back at 10:30ish. Would that be a fair deal? Okay, have fun till then, guys. Any questions?
Plura and plural, can you just repeat that?
Okay, dear. Oops. This here was the membrane around the lungs. Okay. This is more than one. Like apple become apples. Banana become bananas. So these are plural of apple and banana. So it's just a matter of one E between the L and U that becomes just okay, a hell of a difference.
But is that plural pertaining to the membranes of around the lungs, like saying like pertaining to it?
Yes, when you say plural, that becomes pertaining to the plural.
All right, like saying more than one membrane.
Nope. My dear, have you ever heard of what we call single and plural?
Yes.
Okay. Okay. So at the first sight, that's okay. They may look alike, right? No, they're not. But they're not the same because here's okay here. You don't have an E. Okay, so what can you be given? A list of words, and they may ask, okay, which of the following words are spelled wrong? Did you get that? For medical terminology, it's okay, plural is wrong because that's not how you spell plural, which will be pertaining to the plural. Did that make sense? So plural, plural is just more than one. Apple, apples, bananas, bananas, orange, oranges. Students, students. Teachers. Okay, where you say pleural, that becomes just okay, the membrane surrounding the lung. Did I make myself hard? Good. Post. Now, please. This doesn't mean male, okay? This means either behind or back, or in some cases, okay, it may even as okay mean after. Now, usually it's okay when we use it in as okay context, it's okay back or behind. The word that we will come up with is going to be posterior. Okay, where posterior is mean is okay, what we can call a positional term, which means okay means behind, or we can say okay on the back of. Okay, so pretty much okay as if you write A is posterior to B. If you want to say it, okay, as this is front, and this is where we have A, and this is where we have B. Because okay, as this one here is going to be the back. Now this same relationship between A and B can be flipped, but then you have to go and say it's okay that B is to A. And the word that you then will write here is going to be anterior. Or we can say anterior of E. Okay, that may not mean that okay, yes. Okay, sorry guys. Okay. Messed up. My mistake. If we say it's okay, this is A, sorry, and this is B. Then sorry, B is going to be posterior to A. Whereas if we went opposite and say A is going to be as okay anterior to B. Sorry. Okay. When both instances, guys, is okay, we just established that's okay relationship between A versus B.
So is a good way to look at it like your spine, it's posterior because it's behind you?
Pretty much. Okay. Or you can put it this way and say your spinal cord or spinal column is, or you can put it this way, let's be more specific and say your thoracic spine is posterior to the thoracic cavity. Did that make sense? But then on the other hand, you can then say that the thoracic cavity is anterior to the thoracic spine. They both mean the same. It just ends up meaning that, okay, yes, the thoracic cavity is in the front and behind it is the spine. Or the spine is behind and the thoracic cavity is in the front. Okay, you can do the same for for your lumbar space, for instance, or abdomen. And you can say, well, okay, the abdomen is anterior to the lumbar spine. Or on the other hand, your lumbar spine is posterior to the abdominal cavity, right? Okay. Did that make sense? They both mean the same. But just worded differently. Just like you can say as, okay, 5 is greater than 2. Clear? Or you can then also say that, okay, as 2 is lesser than 5. It means the same. Or doesn't it? Saying 2 is greater than, 5 is greater than 2, or 2 is greater than or lesser than 5. It means the same. Just being said in a different way. Because yes, okay, you just flip the numbers. And okay, of course, then you change the word greater than, less than. Likewise, says, okay, when you go center to side, okay, something in the side is going to be medial to something on the, or something in the middle, sorry, is going to be as, okay, medial to something on the side. But then says, okay, this structure on the side is going to be lateral to, yes, okay, the structure in the middle. It means the same. You just define that relationship the other way around. Or if you just look at your room, anything in your room, and say, well, okay, yes, the table lamp is on the left of the couch. But then you can say, okay, the couch is on the right to the table lamp. It still means the same. Did that make sense? Right. Okay. So, and that's why I says, okay, whenever, yes, okay, you use these terms here, okay, it's not going to be good enough to say this structure is lateral. You have to say lateral to what? It's not going to be good enough to say this structure is superior. Superior to what? Or inferior to what? You have to specify that. Okay. Whereas one object is, let's just do it this way here. Sorry. Or let's just go and see, this is A and this is B, whatever. Yeah, okay. Now what can we say is that A is superior to B. Because A is above B, right? But then you can just go on the other side now. it would be wrong to say that B is, if you said superior to A. That's wrong. Because now if you look at it, it's okay, B is below A. So you can say that B is inferior to A. But as far as the meaning of these two statements, yes, okay, they both mean the same. Yep. Good. So in some instances, the guy is okay, even as okay, when we talk about as okay, or we mean posterior, which is going to as okay be behind or on the back of. Okay, but we may not use the word posterior itself. We may just as okay, just use the word post. Okay. There we mean it's okay. We'll say it's okay that the word post itself is okay will mean behind. And we can just, for example, say it's okay post orbital. The L here is just going to be as okay pertaining to orbit. It's okay, pretty much okay as the socket that holds the ball. So that's what you call orbit. So post orbital will be behind the orbit. Clear? Okay. You can say it's okay behind the liver. No, you're not going to say posterior liver or posterior hepatic. Okay, that will mainly is okay. If you said posterior hepatic, that will mainly mean a liver on the backside. Did that make sense? Okay. But when you want to say it's okay behind the liver, then it just becomes post hepatic. Okay. Yep. So in some, it's okay. Or you can say it's okay. It just has to sign correct. Okay. That's fine. I told you it's okay. I'm not going to expect that you guys will learn all of this here in 2.5 weeks. Okay, there's going to be more to it. But as you read more, it's okay, texts, materials, and so on and so on. So you say, okay. Now that makes sense. Okay, guys. Now our next term is going to be ready. Or we can even say it's okay, radio. And okay, not necessarily X-rays, because okay, even it's okay, the word radi can be it's okay used for radiations. Now, okay, the first one that we may be talking about is going to be as okay, radi Now here's okay, O is our combining vowel. And we may say it's okay, logic. Okay. And that means it's okay, going to be it's okay, the study of, well, okay, one example would have been X-rays, but we have other imaging modalities like, okay, CT scans, MRIs, PET scans, etc., etc., etc. Okay. And pretty much, guys, okay, the reason that they are moving away from the word radiology is because, okay, this radio, or actually, it's okay, radiations may be used for something else as well, not just creating scans. And also, it's okay, looking at the fact that a lot of imaging, or what we can call is okay, diagnostic imaging modules will not be as okay, including or involving radiations. MRI is not really radiations. It's just okay, that strong magnetic field. Your ultrasound is not radiations, it's just sound waves. If sound waves were radiations, then that's okay. Even it's okay, us talking and listening would is okay. Be as okay, exposing yourself to what would be radiations. So you may see a lot of places they change the word radiology out to diagnostic imaging. Images that help you get or help in the diagnosis. Or we can say, okay, see the unseen. Right? Yeah. So that's why it's okay. I would just okay, use the word radi. Now we can say again, yes, okay, O is going to be, yes, okay, the combining vowel. And then we go with, okay, that's another suffix here. Is it not going to be logi? Or is it going to be therapy? And dear guys, the word therapy, we can say it's okay, we mean treatment. So radiotherapy, well, okay, does that mean that, okay, as we set our radio off on an FM station or something, and listen to that program as a form of treatment? No, that's mainly as okay where they use radiations to treat. And what is that radiations are?
Is it like lasers?
Okay, yeah, good. So here they pretty much okay as play Star Wars with radiations. Pew, 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 pew. Bombard something. And why would they bombard something with lasers, or let's say in this case, it's okay, radiations?
To kill.
To kill. That's why it's okay, we don't want to play with nukes, right? Because what is it the nukes do? Emit radiations. Not to talk about the amount of heat that they produce, and okay, it's just for a split of a second. But that's going to be enough to melt all your flesh into, I don't know what. Okay. So that's okay. Now, it may sound crazy, but it's okay. A lot of substances that they use now for radiotherapy, as you call it, to primary, as okay, just okay, bombard tumors with. Were actually not made because somebody wanted to use it as a form of therapy, treatment. Or maybe it's okay because they wanted to make a more deadlier nuclear bomb. Oops. So it's not only uranium, that's okay. But that's all about it, okay, that's when all that centrifuge and all that comes into the thing, because they mainly is okay have to make isotopes out of whatever material. So it's okay, radiotherapy, radiation, okay? And you get a dose today, and then okay, I come back and okay, it's 3 weeks for your next dose. Right, okay. Now why you may say it's okay, why not giving it to me all in once?
Because it's invasive, it's really strong.
Okay, it's invasive. But you can say it's okay, probably not okay the strength of a nuclear bomb, but okay, yes, it can become a lethal dose, right? They actually is okay, may get exposed to so much radiation that it may. Have you guys heard of a boxer? You're not heard of a boxer? You guys know what a boxer is?
Yes, like the fighters,
Okay,
boxers.
good.
Yes.
When I say boxer, what else could it be?
Type of dog.
A breed of a dog, yes. Okay, good. But here's okay, we are talking about is okay, the Mike Tyson boxer, right? Okay. Mike Tyson, what else? Who else do we have? Muhammad Ali. Okay, there was a boxer, and what happened was he broke his arm. And he went to the doctor. The doctor said, well, okay, there's nothing we can do about your arm. It's broken in a way that there's no way out, but we have to cut it off. Now that poor boxer was left with just one arm. Now he couldn't box anymore, right? So what did he do? He went home to his wife and said, sorry, hon, I'm probably not going to be able to provide you anymore. Because there was only one thing I knew how to do, that's boxing. And okay, right now I can't box because I only got one arm. Anyways, somebody told him that okay, it's in a field, in a far-flung town, yes, okay, on the top of a mountain, there's a holy man. Go to him and he may be able to just okay, help you out. He said, okay, at least it's worth a try. So he walks the miles, comes and see this holy man, and the holy man says, okay, that's an easy fix. I can make sure that okay, you will get an arm that's going to be as strong as the one that you lost. Here are 5 packets of a powder. So he gave him 5 packets and says, okay, you know what? Just go home. One day in a week, yes, okay, Wednesday, that's going to be my packet day. You just eat a packet. So once you're done with your 5 packets, yes, okay, your arm is going to grow out. Good. And the doc asks, okay, so is there any precautions that I need to take care of? And the guy just goes and says, okay, just make sure that you don't eat them all at once because that's going to kill you. And when he got home, he told his wife, well, okay, this is the story. So in 5 weeks, that's okay, I'll be able to box again. And she goes, oh, no. He's just bugging with you. You know what? Just eat all the 5 packets at the same time. Nothing is going to happen. Poor guy is okay, listen to wife. Ate them, died. Now what happens? They buried him. Now, a couple of weeks later, yes, okay, the guy who's taking care of the graveyard, cutting the grass and make sure that, okay, as the tombstones are, okay, as not broken and things like that, comes and sees, okay, an arm has grown out of that man's grave. So what the? So he cuts that arm, digs up the grave, and, okay, put it back in the grave. Come back, okay, as a week later, okay, as another arm has grown out of the grave. And you go, okay, what the? So he does the same thing. Yes, okay, dig the grave, cut the arm, put it in the grave. A week later, come back, another arm has grown out. And you go, this has no ending. Like, okay. So it's okay, today I'm going to just, okay, fix this problem all and for once. So he came back at night with his spade and, okay, dug up the grave again, cut out the arm and say, and now he just made it, okay, sheltered the person. So now he was lying on his side. Came back a week or so later, and what he saw was that all the people on that side of the grave were out of their graves. And they came up to him and say, listen, buddy, we came here to rest in peace, not to get beaten up by a boxer. So yes, that's why it's okay, dose is important. Okay. Don't take it all at once because it's okay, they had me. So get for me, that's okay when we go and say it's okay. Radiotherapy, that's when we use radiations. Primarily, it's okay to treat cancers. Okay. Now, in some cases, okay, where they just okay take, it's okay in oncology, because that means it's okay to treat cancers. But in that oncology, you may see it's okay something where they go and say, well, okay, you're going to be called into the Department of Nuclear Medicine. But here it's okay, the word nuclear is mainly it's okay, or it's okay, radiotherapy, where they use radiations. So you may come across the word nuclear medicine and you go, what the? That's mainly it's okay, just where they do or perform what you can call radiotherapy. Did that make sense? Okay. Just because it's called nuclear medicine doesn't mean that you physically nuke the patients, no. But just in small doses. Okay. Not an atom bomb. Okay. So guys, that's okay from therapy. Okay, even if it's for instance, that's okay if we said, sorry, radio therapy. Okay. We can also say it's okay, radio. Therapeutic. Now, yes, okay, this therapeutic mainly is okay, will just me pertaining to, or pertaining to the, pertaining to therapy. Yeah, okay. You may have heard the term pharmacotherapy or pharmacotherapeutic. Now, what is pharma?
From pharmacy, from medicine.
Pharma is pretty much okay, the word for drug, or the Greek word for drug. Pharmakon is the actual word, but it's okay, from that meaning it's okay that they shortened it to become pharma. Clear? Okay. So what's going to be a pharmacy?
Place where you get drugs.
Okay, now you think of, okay, the place where you get drugs. Okay. Actually, okay, well, okay, nowadays it's okay, you get your drugs from the pharmacy, unless, okay, you buy it. No, okay. Somebody stand by, okay, by the light pole down by the corner. That's okay. Okay, good. But pharmacy actually is okay. It was a place where they made drugs. So back in the days, before we had pharmaceutical companies, it was going to be the pharmacists that were making drugs in the pharmacy. So they made us, okay, it pretty much looked like, okay, witchcraft. A little bit of this, a little bit of that, and so on and so on, and make a mix. Okay, yes. And okay, yes. Mix this mixture here in, okay, yes. Water, soup, whatsoever, so 2 teaspoons 5 times a day or something. Or so. But pretty much, okay, where the literally is, okay, will make the drugs, that was what they were called, the pharmacy. Where they made it, and okay, yes, they gave it to you. So, good. Okay, guys, now another word where you have to be careful. And that's this fellow here. Sacker. Where we can say it's okay, we may have the abiding vowel. O. Okay. You can say it. But when we say sacker here, it's okay, you may come across a word sacrum. Okay, guys, now when we say sacrum, that's means it's okay, that's going to be the name. Given to that bony plate, which was made of the fusion of the 5 or in this case, and we'll call it, okay, sacral vertebrae. Okay, so those 5 sacral vertebrae is okay together form what we'll call the sacrum. Okay, where we can just say here that okay, a sacral mania is okay, just mean pertaining to the sacral, which is your sacrum. Did you guys get that? Okay, guys. Now, please, please, please. Make sure that you know the difference between these two. Is that clear? And you can see it's okay, just okay, yes. Flipping the letters, or these two letters as okay here, back and forth, that will change because this dude here is going to mean flesh. Okay, because for instance, okay, say here's okay that we may have or be as okay sarcoma. But you can also say that okay, yes, writing it like this is going to be wrong. Because sacra is going to be your sacrum, and oma is going to be a mass. Okay. Now you probably as okay would not come across the word sacroma. Yeah. Okay. Now you can say it's okay if you definitely want, yes, okay, a mass in your sacrum. Just think of what is that the sacrum is made of. Your vertebrae, which is just bones. So you can say, it's okay, you may have a mass in the bones, in the sacrum. Okay, so a mass in the bones of the sacrum can be, as okay, what you can call a sacral osteosarcoma. But you say, okay, yes, we have an osteosarcoma, which is a bone cancer of the sacrum. You guys get tut. So just switching one letter or the position of two letters switched is going to just, okay, change the whole thing. So there's nothing known as a sacroma. Okay, it will be sarcoma. It just becomes just, okay, yeah. Cancerous mass of your muscles, which might be myosarcoma, or connective tissues. Where we said, okay, bones, cartilage, fat, and fibrous tissue. So osteosarcoma, cancerous tumor of bone. Chondrosarcoma, cancerous tumor of cartilage. Liposarcoma, okay, cancerous tumor of lipid. Or maybe it's okay, what we call it, okay, subcutaneous fat. But anyways, and fibrosarcoma, fibrous tumor involving the fibrous tissue, or derived from a fibrous tissue.
Did you say blood was a connective tissue yesterday
Yes.
too?
Yes.
Okay.
But here it's okay. You can't say fibrosarcoma. Oh, sorry, hematosarcoma. There's nothing known as that.
Okay.
Okay. And that's why I said, yes, okay, that blood is a little bit unusual type of connective tissue. Because if you look at the other ones, whether that was bones, whether that was cartilage, even if that was fat or fibrous tissue that physically binds tissues together. Okay. So the question is, okay, why in the blue would they put the blood into a category of being as, okay, connective tissue? Because it physically doesn't hold tissues together, right? I said, okay, five. They may have said, okay, 4 is enough. Okay, 4 is enough. Otherwise, it's okay. They will have to just okay make up a separate tissue or type of tissue for blood. So they will say, okay, well, okay, as long as the blood is running, it still is okay. Maybe not physically, but it's okay, just based on its motion, it's okay, go from tissue to tissue. And that way it's okay, connect them together. Right. But otherwise, it's okay, those other 4 ones, bone, cartilage, fat, and fibrous, sarcoma will be cancerous. Plain omas, benign tumors. Did you guys get that? C. So for sacral, that's okay. Either you have sacrum, which is this whole thing here. Okay. This whole thing is okay. This big plate, which is made of okay, as your 5 sacral vertebrae fused together. Okay. And it's pretty much going to be as okay what lies anterior to this is really as okay the pelvic. Next to spin or O. Or you already have said spinal. And this is going to be as okay pertaining to the spine. Okay. Here's okay, the spine is okay. What do you mean? Yes, okay, called spine. Most likely as okay will be as okay what we can call the backbone. Right, okay. But then we as okay in the spine as okay we had something that we call the spinal cord. Okay. Hey, this was always okay, just spine or backbone. Yeah, just become is okay or pertaining to. And Probably that's okay. The reason that they may call it cord, because usually when you think cord, that's okay, you may think of an electrical cord or wire. Okay, for me, that's okay because it is physically, it's okay, just looking like a long wire. Not only physically, it's okay, but just like, okay, as you can say that, okay, electricity runs in an electrical wire. So is it that nerve signals, which are going to be as okay, chemical and electrical, runs in your spinal cord. And let's say it's okay from the tips of your finger to your brain. And you say, okay, shit, this thing is hot. This thing is cold. This thing is pointed. This thing is sharp. Or back. Or you can say from your brain to your hand or fingers. I want to grasp this thing here. How is all that possible? Due to signals running from here to the spinal cord to your nerves, through your arms, to your finger, and you grab a pen. Okay. So it may sound crazy, but it's okay. It is electrical signals. Not electrical signals as we know from SOK gadgets in your house, but more of a chemical electrical signal. Correct. Now, please, guys, as I said earlier, we can make this okay that here is okay. The C mainly is okay because the letter X has been replaced by C. Right. Although it's okay, the actual word was thorax, which just means chest. Yeah, okay. Now usually it's okay, this C here. You may as okay only replace the C X out with a C. If yes, okay. If that the word thorax is going to be followed by a suffix. Otherwise, we may just stick with thorax. Now we can put it this way and say we have thorax. Now when I say thorax, then I mean that's okay that I will be using a suffix. Oh yes, okay, we can say okay, we combine it with a combining vowel, and we may say it's okay. For a cotomy. Okay. Now what would the word tomy here mean? Cutting into. So for instance, okay, what would be a thoracotomy? There you have the thorax. And you mean it's okay, just make a big incision. Okay. Now usually it's okay, these incisions here is okay, maybe. or even if it's a regular small incision, but that's okay. It will still be called a thoracotomy. Okay. Even it's okay if they make an incision to, it's okay, do what we call a CABG bypass. Now, most likely, it's okay, in those cases, okay, they will go through here. Cut up, yes, okay, the chest bone. That can still be called a thoracotomy, or more specifically, it's okay, they will go and say it's okay, sternotomy. Cutting off of the sternum of the chest bone. But anybody who knows that's okay where the sternum is will knowing that understand okay, that's still going to be as okay a thoracotomy. Right. But as okay, a bigger or smaller incision into the thorax will be referred to as a thoracotomy. Yeah, okay. Now, they mainly as okay, may get off on that, and actually as okay nowadays. 2 is okay, what we can call as okay a thoracoscopy. There is okay again, it's okay, just puncture 2-3 small holes. One hole is okay, goes a scope. And 2 is okay, there are 2 holes. That's okay, tools and instruments to operate on something that's okay inside the thoracic cavity. So that will be as okay, thoracoscopy. Did you guys get that? Okay. Good. Let's just talk of okay as something where we go and say, well, okay, what about if we don't want to use the word thorax? But actually, yes, okay, we'll stick with thorax. Now that's mainly going to be as okay when we just say as okay. Thorax and okay as most likely as okay, there will be no suffix. Right? But if you just leave thorax like thorax, then it's thorax like thorax. Okay. But if we put a prefix, if you so I put a prefix in front of it, okay, we may still be able to just okay use thorax. But only as okay if we didn't put a suffix as well. Now there's going to be a word that we call is okay pneumothorax. The O here is mainly as okay, just your combined vowel. And what does the word pneum mean?
Lungs.
Good. Yes. We use it in reference to lungs. So is pneumothorax really a thing? Where are your lungs, dear?
On your chest.
On your chest or in your chest?
In your chest.
Okay, in your chest. Okay, good. So, good. I know that I said that, okay, yes, in most instances, okay, we may use the word pneum as reference to lung. But what I also said at the same time is that literally the word pneum means what's the literal meaning of pneum? Forgot? Ear.
I was just gonna say it.
Okay, well, ear. So what would pneumothorax now mean? It's not everybody is going to be suffering from that. It's actually, in this case, going to mean it's okay, ear in the thorax. Or more literally, a phenomena is okay. A phenomena, a condition in which is okay, there's buildup of air inside the thoracic cage. Not in the lungs. You would like that air is okay, that enters your thorax to be in the lungs. You don't want it to, it's okay, escape the lungs and okay, as get into the thoracic cavity. Because this becomes it's okay, a competition of okay pressures. So this thing here is okay, can also be life-threatening. Pneumothorax, now what can happen or what can cause it? Fracture ribs. Okay, if your ribs fracture, what is it that they may do? Poke a hole in the lung, right? And now air that you breathe in, some of that is going to just okay, get out of the lung and actually it's okay, build up, accumulate in the thoracic cage. And what that will do is maybe it's okay, just increase the pressure on the outside of the lung and your lung will not be able to expand every time you want to breathe in. Okay. US, okay, somebody got stabbed, punctured lung, yes, okay, good. Not good, but okay, that can lead it to. Okay. And guys, if any of you smoke, maybe it's okay, this would be as okay, reason to stop. Because there's something that we used to call is okay, not used to, we still call it spontaneous pneumothorax. Nobody stabbed you, you didn't get shot at, you didn't fell down and okay, as fracture a rib or so on, so on, so on. So out of the blue, you may be sitting doing nothing. And the next thing you know, you will have okay difficulty in breathing. So that's going to be spontaneous. Now, one of the things that may lead to okay, that spontaneous pneumothorax is blistering on the lungs. You guys know what a blister is? Or have you ever burned yourself with hot? Yes, Michelle?
Stars by accident.
Oh, okay, excellent. Okay, no problem. Scalding hot water. What is it that you develop? Blisters. So similar as okay, they made as okay, it just looks like okay, a smaller, bigger balloons on the surface of the lung. Now, common reason for those blisters, now we used to call them bullae. bullae, B-L or B-U-L-L-A-E, is more than one, or plural, bulla, B-U-L-L-A is one. But may is okay, a blister on the lung which may just pop. And what do you have now? Yes, okay, pretty much okay, communication between your lung, where ear is, and the thoracic cavity. So with each breath you take, some of the air that you inhale is going to just okay leak out through that hole and okay accumulate in the thoracic cavity. And reason number one for is okay those bullae, right? Smoking. So you haven't started smoking yet, don't. And if you are smoking, well, okay, here's one more reason why not to smoke. Sorry, guys, I may sound like your father or mother or grandmother. Whosoever, that's okay. Good. So that's okay. That was okay as pneumothorax, where we didn't change the word XR with a G, right? Okay, or C. Now, just one last one. Okay. Before we go, let's just, okay, so it makes a little bit of sense. Okay. Because we can say somebody may come in with what we call a pneumothorax. And this is still as okay going to be as okay your chest. Or we can make it okay. I think that's okay will be your thoracic cavity. Where hem is blood. And over here is okay, mainly is okay, just what you're combining about. So pretty much okay, as far you can say it, okay, will be like I mean, there's going to be as okay bleeding into the thoracic cavity. Now, what could be the reason for that? Again, yes, okay, stab, gunshot wounds, things like that. Okay, that the blood vessel bleeds, but that's okay, that blood, or some of that blood, will accumulate in the thoracic cavity. Okay, some of the blood is okay, may yes, okay, exit through, yes, okay, the stab wound, gunshot wound, whatsoever. Did you guys get that? Okay, Vicky, you signed in 2 times.
My internet keeps dropping. I just had to go.
Okay, no problem.
Yeah,
no,
I'm not leaving. I just keeps.
No, you're down to 1.
It keeps, yeah, it keeps
Okay,
dropping. So
that's fine. No problem there.
okay.
I was like, okay, all of a sudden it's okay. I have more people as somebody just Zoom boomed us or what? Okay. But even as okay, God forbid, as okay, rupture of okay as a bigger vessel within the thorax may cause bleeding into the thorax, right? Okay, so that'll be yes, okay, just hemothorax. Okay. And okay, guys, there will be instances, okay, where there's going to be both fluid. Now that fluid may not necessarily always be blood. And air inside the thoracic cavity. Okay. So that's okay. What would you say is okay when you have both blood or fluid and air in the thoracic cavity? Now, just because it's going to sound more sexy, if you want to put it that way, it's just going to be because, okay, pneumothorax. Why not the other way around, pneumohemothorax? I guess, okay, they didn't find it sounding as chic. So mostly it's okay, blood. If not blood, it's okay, any fluid. It's okay, along with air. It's okay in the thorax. Or we can say it's okay within the thoracic cavity. Did you guys get that? Okay. Now, what may be done, and let's say it's okay, a hemothorax. They may do, yes, okay, what they will call, and that's when it's okay, going to go back to thoraco. O. And here we go, cis. So the cis here mainly does indicate that this whole word here is okay, it becomes the term of a procedure. Of your thoracic. And what the scent here, or scent is going to be, is mainly going to be, we can say either to puncture or more rather is okay, aspiring. Now, what is it that aspiring is going to mean? When they use a needle and syringe to suck out. That's going to be aspiring. So why would they use a needle and syringe? To suck that blood out of the thoracic cavity. So that procedure we refer to as a thoracocentesis. Okay. Any questions, guys? Nope. Nothing? Not even a word of wisdom? Good. Vez beta. Oh, sorry, not an RH, sorry. Back key. And of course, okay, we can use the combined vowel. Oh. But yes, okay, the word trachea actually is okay, is derived from the term trachea. Okay. Trachea. Which mainly is okay is going to be as okay, or we can call the windpipe. Now when we say trachea, yes, okay, you can say, or you can go for trachea. It's okay, trachea. And then else, that becomes tracheal. Okay. Yes, okay, in anatomy physiology may talk about it's okay, or may do say it's okay, tracheal rings, or more correctly, cartilage. Okay. Another thing is going to be it's okay, tracheotomy. Which means it's okay, will mean it's okay, cutting into. Mainly because okay, your trachea is going to be as okay, the windpipe. Now, if something is okay, gets stuck in your airways, upper airways, or it's okay, the patient maybe is okay, choking so badly that okay, they can't dislodge that penny, a quarter, or Lego block, or whatever somebody is okay found fun to is okay playing with. Yes, there may be no way out but to is okay puncture a hole in the trachea. Right? And now what they may do afterwards is okay, they put in okay as what you can call it's okay, a tracheal or tracheostomy cannula. It means okay, just a little L-shaped thing that they put in, and okay, through that is okay, the patient will be breathing until and unless that foreign object, as we may call it, because we don't really know what it is, right, is taken out. For some case, yes, okay, in some patients, yes, okay, this tracheotomy here, yes, okay, may become more of a permanent thing. Okay. Now you may have seen, yes, okay, those campaign videos on the TV to campaign against smoking, right? As somebody is sitting and talking and they sound like, okay, as the little robot from Star Wars. And they have, okay, this big permanent opening in the trachea. Have any of you ever experienced somebody who walks up with, okay, sorry guys, Okay, that's fine. Not mind what it looks like, but they have this little gadget, and okay, they have to place it up, and then they start talking. Yeah. So that was okay. That's a bad case. Okay, so that's mainly because okay, they have a permanent tracheotomy. Okay. And actually, as okay, the sound that we produce as we are speaking is produced in the larynx, which is just about but it's not going to come out. Okay, for us, yes, okay, those waves comes out through the mouth, and you hear it. That may not be the case for them. And it may sound like, because what is it we have in the voice box or larynx? Is that's where you have your vocal cords. Now it may sound like nothing, okay, yes, but cancer of the vocal cords is pretty malignant. So they may have to, yes, okay, and God forbid, yes, okay, remove the vocal cords. Or you can say, okay, even if you don't remove them all, that's okay, but okay, yes. The section of part of them is just going to, as okay, make the vocal cords almost as okay, not able to produce sound at all. That would make sensible words coming out of your mouth. So that's why it's okay, they may have to, it's okay, be equipped with that gadget. So yeah. Last tooth, but not the least tooth, vertebra. Now what were vertebra? The individual bones of your spine. Clear, okay? So what we can call the spine can also be referred to as the vertebral column. Because it may, okay? Now why column? Please keep in mind, guys, all anatomy is studied by, okay, mainly assuming that the person is standing up. And anything that goes down like this is going to be a column. Thing that goes like this, what would that be? If this is a column, then what is this?
A row.
Huh?
A row.
Row, exactly. So rows and columns. Good. After many years, my dear, that's okay. Heard somebody saying that. Okay, so this will be columns, this will be rows. Good. So vertebral. Okay, vertebrae is going to be more than one vertebra. So plural of a vertebra is vertebrae. Okay, dear. So singular vertebra. Plural vertebrae. Okay, so we can say as okay, one thoracic vertebra. That's okay, the 12 thoracic vertebrae. Or even if we just went just 2 thoracic vertebrae. Okay. Yes, my dear.
Doesn't the thoracic like part have 12?
Yeah,
Or-
but I just to, because I said vertebra is one, vertebrae is more than one. So when you say one, that's going to be singular, right? When we say more than one, that becomes plural,
Okay.
which is plural and not pleural. Okay, even as okay for your coccyx, there's going to be more than one. Clear? Okay. So you can say, okay, one vertebra, the 12 thoracic vertebrae, or the 33 vertebrae of the vertebral column. Clear? Okay. Now, let's do it this way. We can say it's okay, vertebral. Pertaining to is okay, the vertebrae. Okay. So in the vertebra, or is okay, in the vertebral is okay. Then it's okay being stacked on one on top of the other. Yes, okay, of one another. Was it is going to be here, for instance? Is there going to be, yes, okay, a canal? Okay, so it's actually going to be, yes, okay, in this vertebral canal here. That's going to be, yes, okay, your spinal cavity, through which your spine is going to be running. Now, the reason that we'll call it a canal is mainly because, okay, what the vertebra also will be doing is, okay, giving an out is, okay, a process that comes around from both sides. And pretty much, okay, is encircles the spinal cavity.
So is the spinal cavity posterior to the vertebrae?
No, no, it's
Oh.
going to be anterior to it.
Oh, okay.
Okay. Mainly it's okay, what we will call is, okay, the body of vertebra. Okay, now for that you have to, okay, know the structure of the vertebra, or each vertebra itself. Okay. That's okay, that's going to be something that we call the vertebral canal. The canal in the vertebra. Okay, but that's going to be mainly as, okay, formed because, okay, the vertebra are going to be stacked on top of one another. Okay. But what the vertebra actually is, okay, do, you can say it's okay. If this is the body of the vertebra, it sends out process that goes like this. And what do we have then? A canal. We call vertebra on top of vertebra on top of vertebra. And each vertebra send out process that mainly is, okay, in circles. And it's going to be, okay, within that vertebral canal formed by the vertebrae being stacked up on one another, we have what they call the spinal cavity. And then your spinal cavity is your spinal cord. But the only area is okay where the vertebra or meat is going to be as okay, or physically is going to be as okay in the body, the main bulk of your vertebra. Let me see. Let me do it this way, guys. Can you guys see this? Yes, guys?
Yes.
Good. So this here is your vertebral bodies. And what we mean is, okay, here is going to be as okay, will be your vertebral column. Oh, sorry, vertebral canal. Okay, which is pretty much okay as where you have your spinal cavity. And what you see here is okay, those are what you can call as okay, the thoracic spinous processes. So if you, for instance, okay, run your finger or hand down along your spine, at some point you may feel some bony or feel some bone. That means okay, those thoracic spines.
Would you be able just to pull that up again? And where was the
Okay,
spinal cavity in that picture?
I tried to download it, but it won't let me.
Oh,
So
that's
here,
okay.
my dear, this is all these. Yes, okay, this is all just your spine. But pretty much okay, yes. Here, that'll be as okay where you have your spine or your spinal cavity, okay, which we also as okay can refer to in this context here as the vertebral canal. And again, it's okay. You can see it's okay. The color is cervical, thoracic, lumbar, sacrum. So you see it's okay. The sacrum is means okay, just a plate. It becomes just okay a bony plate. Okay, that means it's okay. This is going to form it's okay the posterior boundary of your pelvic cavity. As the rest is just going to be as okay formed by as okay the pelvis. Okay, and then okay as your coccygeal vertebrae. Guys. Any questions? So how ready are you guys for tomorrow? You know how to get to the school? Okay. You haven't forgot that yet. Okay. Yeah, okay. Okay, guys. Now